blessings, love and light, kings and queens. Welcome to another episode of Queen Up. I am Lady Nicole, and I am delighted that you have taken the time to join us on this episode where we are focused on women's health. This is a very important topic that we take very seriously. So let's get started. But before we do, I need to introduce our royal representatives that we have with us today. Dr. J.
Hi.
Tori. And Kim B.
Good morning.
And also joining us today is our expert guest, Dr. Dominick Bioh. Dr. Bioh is based out of New York. He is an internal medicine specialist, and he joins us with over 20 years of medical experience. So he is going to help keep us informed on today's topics. Welcome, doctor. Thank you so much for taking the time to join us out of a very, very busy schedule that we know that you have. How are you today?
I'm doing fine. Thank you for having me.
Thank you. Okay, ladies and doctor, let's get started. Our first segment is thyroid disease. Now, thyroid disease is a disease that targets the thyroid. The thyroid is in front of the neck. It is shaped like a butterfly. It wraps around the windpipe, your trachea. It provides hormones to the body. So when that acts up, all kinds of things can happen. So there are two types of thyroid, hyper and hypo. If you have hypo, like I do, your body produces too little of the thyroid gland. Hyper is when your body produces too much. Some of the effects of having hypo is fatigue, weight gain, forgetfulness, hoarse voice, body temperature irregulations. That is not fun. And sometimes you're a little irritable, just a little, but I think that's everybody every now and then. If you have hyper, you have unfortunately anxiety and weight loss and vision problems. So thyroid can affect anybody, men, women, teenagers, and elderly, but it is most common in women. And if you do suffer from thyroid disease, you should be under the care of a healthcare provider. It's a very serious disease that needs treatment. So, doctor, did I miss anything?
No, you were on point.
Okay, good. I think I covered most of it, right?
Yeah, you were on point. Yeah, it's a condition that, or conditions that can fly under the radar because outside of the symptoms you mentioned, it may be present for years without really making a connection as to why you're feeling the way that you do. And it's not until sometimes blood tests are done and or a scan, a sonogram, an ultrasound of the neck to see if there's enlargement or irregularities. It's not until then that it's diagnosed and then of course appropriately treated.
Right. Now, could you explain why some people have to have surgery? Like I had to have surgery. I had to have my thyroid removed, but there are others who have thyroid disease that could just kind of function with just taking medicine.
Sure. So many of the reasons why surgery becomes an option for treatment in addition to medication is actually size. I mean, that's really the main components in which surgery may or has to be done. As you mentioned earlier, the thyroid is located in the middle of the neck, shaped like a butterfly, and actually it's almost like a little hand wrapped around the trachea or airway. So of course, when it gets enlarged, that can start to compress the airway and then interfere with the functions such as breathing, of course, and then voice changes and swallowing if it's severe enough.
Okay. Wow. Yeah, it's a very serious thing, and one that I really didn't know about until I was diagnosed with it. You hear about people having thyroid and it's like, okay, but once it kind of hits your home, the effects is just sometimes just terrible. There are days when I can't even get out of the bed, but I do have more good days than bad days. The medicine really helps a lot. So surgery was not my first option. I did not want to get surgery, but I'm really glad that I did. So I would encourage anyone who has these symptoms to go get checked out to make sure that you are good. And if you do have thyroid, take your medicine and do what the doctor says. It does help. So thank you, doctor. So our next segment, we're going to be talking about menopause. I know a lot of women think that that's a bad word. They cringe at the word menopause, but it is a natural stage that most women experience. So Kim B is going to talk to us about menopause.
So, good morning, everyone. I'm going to refer to clinical studies. So, menopause, first of all, is two different steps, two different phases, perimenopause and regular menopause. So, perimenopause is like the beginning step of the process. You can get that anywhere between 25 and 50 years of age. Now, I am 54, and my doctor states that I'm still perimenopausal versus going through full menopause because I still have a monthly cycle.
Okay.
Why? I do not know, but that's what the doctor told me. So there are a lot of side effects. They are, taking certain medicine. So a lot of people, especially women of color, we would like to try to start off maybe taking some natural medicine. I am not on any natural medicine. I'm just trying to be a big girl about it, but it's a little wicked. There are a lot of side effects that menopausal women have that I have, such as hot flashes, night sweats, mood swings, low energy, weight gain, stress, low sex drive, joint aches, sleepiness, headaches, and difficulty with concentrating. So even though I'm still considered perimenopausal, I am getting a lot of the menopause symptoms.
Okay.
Dr. Bioh, is there anything that you can add to it?
Not at all. You said it all.
Okay.
Yeah, no, it's actually, obviously it's a condition that many women experience when they get to that point in time. And as you stated, it can be very, very disruptive.
Yes.
Just to quality of life. Such as just daily functioning, sleeping, as you mentioned.
Yes.
Energy level, moodiness, all those things clearly can disrupt your life.
Yes.
Obviously affect relationships, etc.
Yes,
There are
absolutely.
things we can do preventatively to minimize these symptoms, such as you mentioned, some people use natural methods or natural supplements, excuse me, in order to help reduce the symptoms. In addition to, I typically use it as an option of last resort, hormonal therapy. But that's if, everything has been exhausted and individual is just miserable or just has a poor quality of life. And even with that, we use the lowest dose possible because hormonal treatment can have its own individual risks. That woman's health. So
Okay. Thank you.
And doctor, how long do most women experience menopause? How long does it last usually?
Well, that can vary.
Yeah.
Honestly, some women may start to experience symptoms as early as in their 40s. And actually it may stretch out way into their 60s.
Or 70s. Yes.
Yeah, or even later. Yeah, very varied. There's no specific pattern or time frame or even risk factors that say this person will experience it versus another individual won't. So when it comes to that, everybody's very individualized when it comes to it. We just try to support as much as we can to keep them healthy.
Right. Wow. Women go through a lot.
Yes, we do.
Yes, we experience a lot.
Yes, we do.
Okay, let's move on to Tori. Tori is going to talk to us about lupus.
Yes, so lupus is an autoimmune disease where Basically, the immune system attacks the body's own tissues and organs. It's a chronic long-term disease, and it can cause inflammation and pain in any part of someone's body.
Yeah.
As far as age groups goes, it impacts mostly women from 15 to 44. And unfortunately, African-American women are more susceptible to getting lupus. Also, it could be a form of genetics. If you have someone in your family who might have lupus, you might be more prone to getting that disease.
Mhm.
As far as the causes, like I said, genetics and also environmental factors could impact or increase your chances of getting lupus. Something such as sunlight or various infections or even medications could be a cause for someone to get lupus. The most distinctive sign of lupus is the facial that resembles the wings of a butterfly unfolding across both cheeks of the face. And unfortunately, not all lupus cases are alike. So the symptoms or the flare-ups and inflammation can occur in different parts of anyone's body who actually has lupus. So no two cases of lupus are the same. As far as treatment, there are some over-the-counter medications that might assist with inflammation, as far as possibly Aleve or Advil. There are also corticosteroids and immunosuppressants that could assist with treatment for lupus. And I did find some information regarding alternative medicine, as far as fish oil or even acupuncture can assist with inflammation of lupus. And I wanted to ask you, doctor, do you have any advice or tips for somebody coping with lupus?
Yeah, thank you for that information. That was, obviously help enlightening all of us. But as you stated already, lupus can just ravage all organs of the body. And of course, we talk about the physical aspects, but there's definitely the mental aspects. People suffering from chronic pain, disfiguring rashes, chest pain, shortness of breath, etc. All those things obviously can have a psychological effect on it, not being able to function, work, relationships, activity, etc., etc. So to answer your question, there are a lot of support groups for those individuals who have lupus and similar medical syndromes. Lupus is one of those conditions that can imitate a lot of different conditions, and there's a lot of so what I'm looking for, crossover in terms of diagnosis. So we consider lupus, or people see the physical features of lupus, which is, as you mentioned, the rash, we call it butterfly rash, malar rash. But clearly, most people don't have any physical manifestations. If you just looked at them, it's all internal. So they could have kidney disease, eye disease, heart disease, vascular conditions, etc. So there are many support groups to help support the psychological aspects, because many of these individuals experience, deep depression, severe anxiety, things that just don't help alleviate the condition that they're dealing with in terms of trying to function, even with the use of medications. And that's only if those things even help, because sometimes there are folks that no matter what you throw at them, they just don't respond.
Right. Wow. Wow. Thank you so much, Tori and Doctor, for that information on lupus. We appreciate that. So Dr. J is going to talk to us about breast cancer.
Okay, well, I will say that this is a topic that's close to my heart, mostly because my research that I had done to get my PhD was in this area. It actually looked at religiosity in African-American women with breast cancer. And so I mentioned that because I'm so grateful for some of the information that I received from the women that were gracious enough to allow me to interview them to complete that. So just wanted to share that up front. So as far as breast cancer is concerned, what we find is that essentially it's the second cancer, or largest number, or breast cancer is the second cancer for women. First is lung.
Mhm.
And unfortunately, 1 in 8 women will be diagnosed with breast cancer during their lifetime. So it's a lot. But the good news is that there are many, many treatments. What is breast cancer? Essentially, it's cancer of the breast tissue. There are different stages, there's a number of treatments that are involved depending on the stage of disease. It could be surgery, it could be endocrine therapy, it could be radiation. It all depends. As far as what causes breast cancer, we really don't know. There's a hereditary component, but then also there are a number of risk factors that we believe are involved in breast cancer. Some of them might be obesity, it might be excessive alcohol use, it could be lack of exercise. Those are all things that we can do to lessen our chance perhaps of getting breast cancer. So as far as controllable factors, controllable factors are the ones that I just mentioned. Uncontrollable would be things like age. As you get older, you have an increased chance of breast cancer, and just being female. While breast cancer occurs both in men and women, it is certainly less common in men and more common in women. The variety of types of breast cancer, depending on when it's found, as far as when it's staged. Later on, it's a possibility that it could become metastatic. But the bottom line is that mammography or early screening is very, very important.
Mhm.
The last thing that I'll mention about it is the fact there is a type of breast cancer called triple negative breast cancer that is actually one of the more aggressive types and found more often in African American and Hispanic women. The reason I mention that is because there are a number of therapies that traditionally women might be treated with, like endocrine therapy or more targeted therapies that are available. Unfortunately, none of those work in triple negative disease or triple negative breast cancer. So with that, it's thought that it's important certainly to consider clinical trials. But most importantly, I would encourage any woman or man who's diagnosed with breast cancer to be sure that you stay close with your healthcare professionals and make sure that you and your healthcare professional work together in treating the disease. There are so many options out there for patients, so many clinical trials. And what's thought, particularly in the triple negative arena, is the fact that the biology of the disease might be different. And so there's very often African Americans don't participate in clinical trials, and just really pushing that forward as being so important so that we can find out more about treatment of the disease. Those are the main things that I wanted to share about that disease.
Wow, great. Doctor, did you have anything to add to that?
No, I just wanted to touch on some key points that you mentioned. And first and foremost, as you initially stated, the most common cause, or second most common cause of death, cancer death, excuse me, in women is breast cancer. And that has a higher prevalence in African American women. So clearly you can see how it impacts us. And then one of the most important things that you mentioned is, of course, the impact of this triple negative breast cancer, which is also more prevalent, unfortunately, in African American women, or in any woman, I should say. But nonetheless, the importance that you mentioned of participation in clinical trials is very, very key, especially amongst our population, African American population, because there are a lot of disease states that operate very differently than our other counterparts. And until we get better knowledge of that, our survivorship going to increase. Our early diagnosis is going to improve. The whole point of screening is for prevention and early intervention. And unfortunately, our population typically is diagnosed much later in disease, where the options are very limited, if any at all. So it's very, very important people are educated in making sure they're getting their screening done. Try to understand their family history. I know sometimes that could be a little bit sketchy in terms of people disclosing, our relatives rather, disclosing their health history, or even being aware of what their health history is. And then, of course, being consistent with it. Don't just go every 5 years or every 10 years. You got to go every year or every 2 years, which is the current recommendation in terms of breast cancer screening, is having a screening screening mammogram, every 2 years.
Absolutely. Thank you for that information. It's
Sure.
important that you get checked out, ladies, but it's also important that you know your body.
Yes.
So don't be afraid to touch yourself. You know what belongs and what doesn't belong. So you have to get in the habit of doing that. You know, here on Queen Up, we believe that God can do anything. We believe in the power of prayer, but we also believe that you could pray and take medicine, that you can pray and you might need some couch time with therapists, depending on what's going on with you. You can pray and you might need to put down the fried chicken. So the Bible says faith without works is dead. So you have an obligation for your health as well. So we pray, but we also back up that faith by being responsible and making good choices. There's some things that chicken noodle soup, saltines, crackers, and ginger ale are just not going to fix. Now, don't get me wrong. My grandma's chicken noodle soup was jumping back in the day and it made me feel better. But sometimes you need to handle your business and go see a doctor. We need you to take care of yourselves, know your body.
Yes.
We need you to be comfortable with going to talk to a doctor and being honest about what's going on. So, I mean, I don't want to speak for the doctor, but I'm sure one of the worst things you could do is go see a doctor and not be honest about what's going on. They want you to be honest about, you know, this doesn't feel right. This is uncomfortable. Because how do they know what you're feeling if you're not being honest with them? So we need you to ask questions and handle your business accordingly. We want you around for a long time, ladies. So we want you to have a healthy and happy life. And we just want you to understand the importance of good health. So doctor, before we leave, is there anything that you want to add? Or anything you want to share with the women who will be watching?
Definitely. Well, once again, you're hitting all the key points. It's very, very important that you have a relationship with a primary care physician, someone that you can trust, someone that you confide in, someone that you're not afraid to share whatever is going on with you, as minuscule as you may think it is, because that what may be minuscule to you may be important for the primary care physician interpreting the information. So make it a point to visit that individual at least once a year. 30 minutes of your time in a 365, day per year is a very small sacrifice to impact your overall health and longevity as well. So just make sure you're doing your part and adhering to your responsibilities to make sure that your health is on top of the list of everything that you do.
Wonderful. And before we go, doctor, do you mind sharing your practice information? Anyone in the New York area can come and check you out?
Sure. Once again, my name is Dominick Bioh. My office is currently located right in Harlem on 125th Street. I am soon to be moving somewhere in the area. That's to be determined, but nonetheless, once that is solidified, I will distribute the information to the masses. But you can always Google my name. And of course, when there's an update, you'll be sure to find that information as well.
Wonderful, wonderful. Thank you so much. So we pray that God grants everyone strength and healing who are suffering through any kind of illness or disease. We respect your royalty, kings and queens. And on behalf of Kim B, Dr. J, Tori, and our special guest, Dr. Bioh, we want to thank you for joining us today. And always remember to be the queens that God created you to be. God bless. Take care.
Yeah, bye-bye.